Hi, welcome to another session of A Patient's Perspective, and today I'm going to be talking about some new laws that are really positive for patients. One of them is the No Surprise Act, which will be effective for the most part in January of 2022. And what this is all about is we've probably all heard cases of patients going into the hospital or having other services that they think are considered all in-network by the insurance company, only to get the bill later and find out that some of the charges, for example, maybe an anesthesiologist charge, was considered out of network, thus resulting in a much higher bill than anticipated. And that's what this No Surprise Act is all about. And I'm not a doctor, attorney, or medical professional, so I will not attempt to get into the super specific details, but I can tell you that as a patient, it's very positive in the sense that for some things, there may be caps as to what you can be charged, or you could not be charged an out-of-network rate as you previously could for these surprises, that they would then have to treat it more in-network. And it also has to do with how insurance companies and providers negotiate and arbitrate and so forth. So to find out more about it, I suggest doing a search online. Just put in No Surprise Act and you'll see a lot come up about it. It's a really great thing for patients, and I'm really glad to see this coming forward as we go into 2022. The other thing I want to talk about is something called hospital price transparency. You may have heard about it on the news recently. They also talk about transparency and coverage. And what this is all about is getting the patient to know more about their upfront cost. And historically over the years, we've had patient advocates out there saying that we need more empowerment to know what our final costs are going to be. If you think about it, we buy an appliance and we know upfront the cost, but when you go in the hospital, you really don't know until you get that bill what you're confronted with. So that's what this is all about, and we began to see this moving forward in this direction even back in 2019. Under certain acts that were under the Affordable Care Act, where hospitals began to disclose more negotiated rates and so forth. But there was still a lot of hidden cost. The patient would be quite surprised for some hidden lab fees or supply fees or maybe extra consultation fees. And even the day of the week that a surgeon performs surgery can make that price vary. So let's say, for example, the surgeon does surgery at the hospital on a Tuesday, but maybe Thursday they do surgery at an outpatient facility across the street somewhere. And the difference in cost in those two facilities can vary greatly, even $10,000 or higher. So the patient would really be surprised when they get the bill. So these are really positive changes coming forth, and if you want to find out more about it, you can go to this website, which is the Center for Medicare and Medicaid Services, https://www.cms.gov. And I think what's really good, we're going to see this getting better and better and a steady progression of finding out more about our services as we go through the years. Like right now we're in 2021, so in 2022 we'll find out a little bit more, in 2023 and 24 especially, and you'll see the term shoppable services. So more and more items being added to the list as to what patients will know up front more about. So this is a really positive change, and I'm looking forward to it. So I hope these insights are helpful. So just keep those terms in mind: the No Surprise Act and hospital price transparency. Please join me next Friday. Hope to see you then. Bye.